the third one.
Okay.
Um,
Hmm.
so is there an emotion that in any aspect of your life that keeps you from doing something that you want to do? By doing, I mean taking an action, holding a belief, feeling comfortable about something, any kind of a thing that's doing, thinking, feeling, believing.
Well, I don't know if this would qualify or not, but I'm having trouble walking with because of some pain in my left hip and I think it's coming from the lower back,
Uh-huh.
but it's been going on for way longer than I'm comfortable with.
Right.
And I'm doing different things to work with it, but not really experiencing consistent relief. It's
Okay.
very unpredictable.
Mhm.
And so there's a whole lot of I don't know if we can work with that, but I would love it if we could.
Um,
I don't know if you consider it an emotion because
well,
it's
here's
physical pain.
here's the way physical pain and ailments and emotions interact. Uh, our bodies are incredibly well-designed healing engines. We are unbelievably complex in terms of our ability to heal. It's not infinitely powerful, but it's awfully good. And what happens all too often, and if you talk to any physician about this, they will tell a patient, okay, you want this to resolve, you got to do this, 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 and this, and in this amount. And they might do some of it for the first day, and then that's it. Or, you got to take this medication regularly, and they don't. So just getting patients to follow their instructions is a challenge. Um, what also happens is that our emotions can get in the way of the healing process.
Mhm.
An example is a young lady I worked with who she had some sort of a cervical injury in the neck. One of her vertebrae was damaged, and she had a lot of pain there. And I did not work with her on any of that pain. I worked with her on anxiety.
Mm.
But what she found was that the pain, as her anxiety dropped, the pain was, it didn't go away because there was still physical damage, but it dropped to the point where most of the time it was entirely tolerable. So it's frequently the case that emotions make the pain worse
Mhm.
and interfere with the healing process. Do you have any reason to suspect that something like that might be going on?
I do.
Okay. Okay. What name would you give the emotion involved?
Probably grief.
Grief. Okay.
Mhm. Mhm.
Okay. This is loss of a loved one.
Yeah, the ending of a relationship,
Oh, that's essentially the same.
but I had a very, very similar experience once when I was uh, years ago when I was letting go of an office space. I went to submit my 60 days or 30 days notice letter to my landlord,
Yeah.
and I couldn't get myself out of the car. And suddenly
Oh,
my left leg it was the same experience that I'm having now.
interesting.
Yeah, it was like my body was trying to stop me from
Okay.
moving on. And when
Ah,
I asked my partner to move out, we moved a bunch of stuff out of our storage shed that in the whole transition of him moving out. But it that and I had already had a car accident, so
okay.
there's a lot of physical things.
Yeah.
Moving furniture was heavy, and so there was physical stress and also trauma from car accident. But but it seems like, and then, yeah, just the transitioning away from the relationship, but it was just so similar to that experience of letting go of my office space,
Ah,
because it's
okay.
only on the left side,
Yeah.
feels like it's coming from the same spot. It started with the piriformis muscle, but now it's
Okay.
bigger, and so all of that. So that's why I think maybe it's grief.
Right. Okay. Okay.
Yeah.
Now, um, I'd like you to access that grief.
Okay.
Do what you need to feel the grief itself in your body. And when it's strong enough that it's unmistakable, uh, tell me where you feel the strongest part of the strongest part, the most intense of the most intense part of all those sensations. Where is that in your body?
It's in my chest.
Okay. Can you point to the most intense part of that with your index finger?
Yeah.
Okay. Okay. Now, what I want you to do is to now that it's grief, you feel it, you're aware of it, but uh, you can sit with it, right?
Yes,
Okay.
absolutely.
So, what I want you to do is, sometimes you've had a friend who's working through something and he or she just wants somebody to be there with them. They don't want advice. They don't want to be judged. They don't want to be analyzed. They just want somebody to be nearby, aware of them, and, essentially supportive and accepting. So
Yeah.
I'd like you to be with that sensation in that same spirit of accepting it. It's part of you, the emotions coming from inside, and this sensation, as it resolves, it may intensify, it may diminish, it may move around, it may transform. So the reason I've asked you to point your finger at the most intense point, is to allow you to track its movements if it moves. All right. So just sit there with it. Be with that sensation. This is a sort of being present with yourself on the inside. And simply be aware of the sensations without judgment, without analysis. Uh, and when you find yourself more in your head than you should be, just think, oops, I'm in my head, back to my body. In other words, don't beat yourself up over it. It's a normal occurrence, so just accept it and go along with it. All right, just be with that sensation. That's right.
There's a part of me that really wants to acknowledge that my father died just a few months ago, and then his brother died, my uncle, maybe 6 weeks ago, and then a really precious friend died a couple of
Okay,
weeks ago too. And my partner, the ex that I'm talking about that moved out, had a stroke, and I mean, I could just go on and on and on about.
right.
And then of course COVID, and there's just a lot of grief, a lot of death, a lot of loss.
Right,
So there's
right.
plenty of it there. But I just,
Yeah.
the part of me
And
really wants to acknowledge
yeah.
everything that's happened since this
And
started too.
intellectually, that's a part of life, but emotionally, that's more difficult to do. So just sit with that emotion.
Just keeps coming. Yeah.
Yeah, just sit with it. And it may intensify.
Yeah.
That's not unusual because, especially for emotions that we've been pushing away, because as we relax, as we give ourselves permission to accept them, be with them, and acknowledge them, we become more aware of just how much grief, in your case, how much of this emotion there is. We'll just allow it to do whatever it needs to do. And different emotions need to do different things, and that's okay. Sometimes they move around, sometimes they shift to different emotions. That's right. And what's happening right now, Terry?
It's just, I'm just aware of, there's just so much of it. There's just so
Okay,
much grief. And I'm aware of it, not just in this spot here, but
right,
it's kind of like enveloping the whole upper part
right,
of my body, right?
right. Okay. Let it,
An energy field too.
yeah, yeah. So keep your hand there at the most intense part and allow yourself to be with it. Think of this emotion of all of this grief as if it were a friend who hadn't been allowed to grieve. It just was forced by circumstances to pretend that it didn't happen. And you're finally allowing it to grieve just by being there, just by accepting her, being with her. You're allowing her to get out all that needs to be done to resolve. Because it is something that we often do, especially with grief, is we kind of, oh, I'll get around to doing the real grieving later. You know, I'm I'm too busy in my life to really grieve now. I'll get to it later. And we push one aside. And then something else comes along to grieve about, and something else, and something else, and something else. And it may even feel overwhelming to deal with it all. But deal with it is something we need to do. And as long as we're there, present with our own feelings, acknowledging them, accepting them, and indeed, if the moment arises for you, even sending love to these sensations, because these sensations are trying to help us in their own way. That's right. That's right. Keep accepting. That's right. Because when we fully accept the emotions, the sensations, we allow them to be at peace, which is what they've always wanted, to resolve and let you move on. And what's happening inside now with the sensations, Terry?
When you said, let me move on, I had this imagination of myself walking, effortlessly like I used to.
Right. Okay. And now, when you first brought up these sensations of the grief on a subscale of 0, where 0 is sensation, what sensation? And 10 is, oh my God, I can't handle this. How strong would you say it was at the beginning?
Maybe an 8.
Okay. And when it started to get stronger, how high did it go?
I think maybe the 8 or 9 would be as strong as it went. Yeah,
Okay. Okay. And where would you say it is now?
probably a 4.
A 4.
Mhm.
Wonderful. So you took a grief that's within you at a 9, which is pretty strong. And you've already, in just a few minutes, resolved it to a 4. That's phenomenal. Just be with those sensations. Be with them. Be present with them. And if you find yourself in your head thinking about them, judging them, analyzing them, just say, oops, I better get back to my body and be present.
Yeah, it's just there are some thoughts of like other additional griefs that,
Yeah, yeah, and that's
things that
okay.
I could grieve, you
Yeah,
know. Yeah.
and that's perfectly all right because there are probably others that you've kind of poked down and deferred, and that's all right. There's nothing wrong with that. That's just adding, oh yeah, I forgot this one. Oh, that's one too. That's okay. Allow them all to resolve. Because inside your mind, your unconscious is working, saying, oh, I know this pattern. Here's some other stuff that matches. And then a thought pops up. Those kinds of thoughts are okay. It's the ones you want to say oops about, or where you're analyzing it or judging it, or even worse, trying to fix it. So
Yeah, I don't have very many of those things.
good
Just
for
I
you.
just have a feeling just of acceptance and just like, oh, I didn't, there's still that grief about my career. It's like my business got taken away in COVID because I wasn't essential.
Uh,
And so, oh, there's that grief, and because it drug on for months.
yeah,
It's like you don't know if it's really happening or not. And yeah, there's just like all those things. And so it's like another one and another one. My mind is kind of going there, but otherwise I'm just in my body,
right,
feeling it and breathing through it and being with it.
exactly. And that's what you want to do. Just stay with it. That's right. You're doing really well, Terry. That's right. And as each element of your grief resolves itself, you may feel a sense of perhaps relief, perhaps a sigh, perhaps even joy, as each one is allowed to do what those emotions need to do for you as you resolve them. And notice that resolving your grief over the loss of a job, a partner, a relative, a friend, doesn't mean that you'll never grieve or miss them again. It simply means that the intense emotion that goes with their loss has been allowed to resolve itself. This is all about permission, not about forcing.
And I can give it permission to leave my body.
Yes, if the sensations want to leave, then feel free to give them permission. Be careful not to push them out. That's right. But they have permission to move on as long as you give it to them. And for other reasons within yourself, deep within your own psyche, there may be some that you're not ready to give permission to leave, and that's okay. That's right. Fully present with the sensation, and a powerful spirit of acceptance. That's right. That's right.
I feel waves of it releasing,
Beautiful, beautiful.
Mm,
And 0 to 10, where is it now in aggregate?
maybe a 2.
A 2. Wow.
Mm,
Really remarkable.
mm.
And now, Terry, to be really comfortable with this, do you need to make it go to 0? Or do you want
No.
to make it go to 0?
I think I would like to make it go to 0 so I can walk
Okay,
freely
okay,
without pain.
all right,
I don't need to. I'm comfortable being with it, but um,
all right. So,
I'd love to have it completely gone for the if it's the pain, if
right,
it's related to that pain that I'm experiencing, yeah, and my
right,
hip, my ability to walk,
okay,
yeah.
okay. So ask yourself inside as you're present with those sensations of grief. Ask yourself inside if you're ready to move on.
Yes.
Beautiful. And now ask yourself inside your inner self if that's what your hip pain is all about.
It's saying yes and no.
Ah, okay. So with physical pain, it's entirely possible that whatever your body did to create that physical pain has created an actual injury that needs to heal.
Mhm.
um, ask yourself inside if your hip will be able to heal now.
Yeah, I think so.
Wonderful.
Mhm. Mhm.
That's right. Just feel them like flowing out, like little pulses of energy moving on from you.
Feels like it moved down into my knee, in my left knee.
What is the it that moved down?
The pain that was in my hip
Ah,
moved down to my left
okay,
knee.
okay. See if you can intentionally move it down to the middle of your calf. Were you able to move it?
Yes,
Aha. Okay.
just as you asked. Yeah, just
Oh,
that last second or so.
all right. Now, see if you can make it smaller.
Mhm.
And are you able to make it smaller?
Yeah, it doesn't want to get to a grain of sand, but it's a
Okay.
marble size.
Yeah. All right. And it may be that that's your mind's way of telling you via a symbol that um, the pain that you've been, call it creating, uh, has created an actual injury that's about that size. And then simply continue. I would recommend that you do this same process periodically with the grief and just accept it again and again and send in parallel with that, send healing energy to that marble sized pain. And it's most interesting that you're able to move the site of the pain around.
Yeah. What's interesting is that you said to go to the mid calf, and that's where I felt a lot of the pain for the last while.
Oh, interesting.
Yeah, it's like
Interesting.
there's a pinched nerve, and that's the part that keeps me awake at night is that outside of that left calf. Yeah,
Okay.
yeah.
Well, now, long as we're here experimenting, move it to your right calf,
Okay.
just temporarily.
Mm, okay.
And is the discomfort willing to move?
It did. Yeah. I don't like it there either, but
Right? Okay.
it's different. Mm,
Hmm.
mm,
Well, let's be playful.
mhm.
Um, move it to a spot on the floor.
Okay. That's a little bit harder.
Uh-huh. And a question to ask inside yourself,
Yeah.
because pain pain is important to our survival as
Mm,
a self-healing entity, because pain draws our attention to something that needs healing.
mm,
Or it may be, if there's a broken bone, for example, it tells us, don't move that,
yeah.
uh, or it'll get worse. Sometimes our bodies generate far more pain than we actually need, and sometimes our brain amplifies it even beyond that. So ask in your body, in your mind, in your deep inner mind, how much of this pain you need to experience to protect yourself and heal properly.
I get 0.
0.
Hmm.
Uh-huh. So your mind is saying that you don't need to feel any of the pain to allow healing to proceed.
Right.
Okay. Now, knowing that, move the pain onto the floor.
Yeah, I did get it to go into the floor, and I actually swept it out the door.
Oh, there we go. Okay.
Hmm.
That's pretty awesome.
Yeah, I was trying to find a place to put it in the backyard, but I don't know. Just
Okay.
sending it into
We,
the earth.
yeah, yeah. And, and ashes to ashes, dust to dust, pain, pain to whatever. So this is wonderful. Okay, open your eyes and come on back. That was remarkable. Yeah.
Yeah.
So this is the acceptance part of the process, and we went uh, much deeper than we usually do, and into an area that's some a little bit of caution is needed because of the fact that pain is actually a warning signal as well. So
Yeah.
we have to be very respectful of pain, but which is why I had you go inside and ask how much pain do you need to protect yourself.
Yes.
To get it back as 0, lovely.
Yes. And I know that because I had an experience after a chiropractic adjustment or an acupuncture treatment, or I'm not sure, maybe it was a massage even, but after I did something that where I didn't have any pain inside that hip joint for like a couple of days.
Ah,
And it was like, so I haven't done any permanent damage, or there isn't anything in there
okay,
really that needs to be protected. So
beautiful,
yeah, so there
beautiful.
was a part of me that knew that already, that yeah,
Ah,
yeah,
okay,
interesting.
okay,
Yeah,
yeah. Well, one of my other premises is we all have all of the resources within us to make whatever changes we want to. It's just figuring out how to do it.
yeah, and sometimes it's so much easier when we have somebody else sitting with us, guiding us through it,
Yeah, yeah.
so we don't have to figure it out ourselves or be alone in the process.
Oh, yeah.
Yeah, so thank you. Mhm.
Absolutely. You're totally welcome.